Every 4th of the month, we tell you about ways to protect your heart and get heart healthy. This month, we are focusing on preventing a second stroke. You know, every 2 seconds, someone in the United States has a stroke. It is the #2 cause of death. About 1 in 4 stroke survivors ends up having a second stroke. Up to 80% of second clot-related strokes are preventable, however. Now, joining me this morning is Dr. Nima with Baptist Hospital. Thank you very much for being here. Do appreciate it.
Thank you very much for having me.
So this is such an important message. Yesterday, we were talking about the risk of cardiac arrest. Now, stroke, of course, is a tremendous problem. Can you walk us through a little bit? I know that we've got some animation for those at home who are unfamiliar with what is it that you know, causes this to happen?
Of course. No, again, thank you very much for having me. This is a very important topic because stroke is #1 cause of disability in the United States. When it comes to stroke, thanks to advanced technology and research, we have treatment available for patients who have stroke, but that treatment has to happen really fast. So when the stroke happens, as is shown here, a blood clot most often forms or goes to the brain, which causes a stroke, which prevents blood and oxygen to get to the part of the brain. If that happens, we have treatment available. We can give IV TPA, or now we can go through navigation through the blood vessels and remove that blood clot, and that's called thrombectomy. And but in order to get that done effectively, we have to do this fast, and therefore it's important for the public to know if they have a stroke, they have to call 911 and seek medical attention right away.
Okay, so we need to talk about what the warning signs are, though, of stroke, because we see with cardiac arrest where a patient will drop kind of immediately. Stroke has earlier warning signs that allow you then to get to the hospital to get these treatments?
Yes, you know, there's a mnemonic called FAST. So if somebody has a facial droop or facial weakness, so if one part of the face is weak, or if the arm on one side is weak or not working correctly, or having difficulty speaking, those are the signs of the stroke. And if any of those happen, then you have to call 911 and do not delay seeking medical care.
And can someone typically experience something like that over a couple of days, or is it something that happens and then, you know, right away within 30 minutes, it's too late?
Yeah, so stroke usually happens all of a sudden. However, there are some people who may have some of these problems that come and go, and those are warning signs, and they have to really seek medical attention for that as well.
Now, there is is there some confusion that typically when you look at FAST as an example, the acronym, that some, you know, wives or husbands who see this in their partner, that they may just sort of ignore this as something else? You know, I slept wrong on my arm and that's why it's tingling and numb?
That's a good question. So one of the things about the stroke is it's not painful, so it doesn't have pain, and there's some mimics that presents as such a stroke. So like you said, some people say, well, I'm just going to shake it off and see if that gets better. Or some people may have migraine or different cause of this problem. However, if you have any of these signs, I think it's important to seek medical attention because stroke can happen at any age. It doesn't only happen in older patient, it can happen in a younger patient. So I think that it is better to seek medical attention if you have these signs rather than wait and see what happens.
Are there things that you can do to prevent stroke?
Although we have acute therapy for stroke, the important thing is prevention is the key. So we know that, for example, high blood pressure, cholesterol, smoking, and poor lifestyles lead to cardiovascular risks, including stroke. So it's very important for people to pay attention to their blood pressure, cholesterol, make sure that they are doing a healthy lifestyle to prevent stroke from happening. Once stroke happens, then we can also treat patients, but also afterward, we can prevent the second stroke from happening. And that's why it's important. If you didn't have a stroke, make sure you focus on your risks that I just mentioned. If you had a stroke, make sure that you're seen by a stroke specialist or stroke neurologist to make sure that there are any other causes that may cause another stroke that can be prevented.
Dr. Nima, thank you very much for being here. Do appreciate it. Such important information to keep our viewers safe and healthy as well.